Dr. Sheena Bhuva.
I'm Dr. Benecia Williams.
And together we are Benecia. And today we have our part 2 from the TBI weekend. Special guest today is Dr. Maria Pollifrone and Dr. Beth Miller-Phillips. So Maria is a brand new TBI fellow, and Dr. Phillips is her attending and fellowship director. So we'll kind of cover the whole process of being a resident, applying to fellowship, being an attending, and then actually starting a brand new fellowship program. So thanks guys for joining us.
Yeah,
thanks for having us.
Yeah.
So I met Maria when we were PGY4s at Baylor. She came and rotated with us as a fourth-year medical student. I had heard about her before she got there because Dr. Omar Swat said, I have a student coming. She's amazing. You'll love her. And she was great. I remember telling my program director, Dr. Hamilton, I said, if we don't rank Maria number 1, I'm quitting. Put a little drama behind it, right? And then Dr. Phillips started our 4th year as well. We didn't get a chance to rotate with you because we had finished our brain injury requirement by our 4th year, but everyone else who rotated with you said you were amazing, and we were all jealous as 4th years. We're like, man, we missed out. So yes, if you guys will tell us a little bit about yourselves, Dr. Phillips, if you'll tell us where you're from, where you're training, and then I'll pass it to Maria.
Sure. Yeah, so I'm originally a Texan, born and raised, so grew up outside of Dallas, went to Austin College in Sherman for undergrad, and then Texas Tech. Yeah, go Roos, yeah. But then went to Texas Tech for medical school, met my husband there, so we decided to couples match and just get out of Texas for an opportunity to leave. And so we couples matched at the University of Pittsburgh, where I did 4-year PM&R fellowship in what was it called back then? Transitional year at UPMC as well. And then elected to stay an extra year to do fellowship there as well. So now back in Dallas, and I have 2 little kids, and life is crazy, but good, yeah.
Great.
Maria, tell us about you.
Yeah, so I am also born and raised in Texas. I did my undergrad at Southwestern University in the same conference as Austin College, small liberal arts school in Georgetown, Texas. I was a math major there and also played Division III soccer. From there, I did medical school at Midwestern University, Chicago College of Osteopathic Medicine. And then for my internship, I stayed in the Chicago area and did my prelim medicine intern year at Advocate Lutheran General. And for residency, I made it back to Texas. And then obviously I was at Baylor for my residency and then for my fellowship as well.
Awesome. So how did you guys get interested in traumatic brain injury? I know, was this something that you knew going into PM&R that you wanted to specialize in TBI, or did you come across it later on in your residency? Maria can go first there.
Yeah. So my first experience with TBI, I think I was actually rotating with you, Sheena, when I did my audition rotation at Baylor. And I just remember thinking to myself as a med student, like, oh my goodness, like this is so unique. And I'd never seen anything like it before. And then when I went through residency, I got to really learn more about the pathology and just learning that no brain injury is alike. And then there's so much unknown in the way we treat people with brain injury that really allows for patients to be treated on a case-by-case individual basis. So I think those were some of the characteristics I really liked. Going into residency, I knew I liked brain injury, but I gave everything 100% and kind of, kept an open mind, but it was brain injury at the end of the day that I wanted to do.
Yeah, I had no idea that I wanted to do that. So I think I probably have a significantly different path than what I thought I was going to do with PM&R. The nice thing about PM&R is there's just so many opportunities to do really anything between the musculoskeletal aspect and then the neurologic. But, Pittsburgh is one of the head injury capitals of the world at this point, or it has been. That's where the movie Concussion, Dr. Anyways, the pathologist that was, it's blinking. I'm going to mess it up. But anyways, that's where he was studying, you know, worked with those cases. And I just really knew, initially I thought I wanted to be just a generalist. That's who I had worked with kind of out in Lubbock. And I was like, oh, great, he kind of does everything. But then as I got more into the academic side, really liked just the idea or the concept of brain injury as a true medical specialty. So specific medical issues that are unique to that diagnosis. You know, you kind of get to be the expert on that. And just, you know, really getting to follow people through the course of a lifetime. And for me personally, not to offend anybody, but spinal cord injury, you know, for me, I just wasn't all that interested. Brain injury was just, you never knew which direction it was going to go. So, you know, really seeing people who are so initially low level, then going on to go back to work and school and driving in the matter of, you know, a few months to years is just pretty incredible. So just that unpredictability was really nice.
That's very rewarding. We had Dr. CJ Plummer on yesterday, and he's a TBI attending at Vanderbilt. And he was saying the same thing, like to be able to go by case and individually treat each patient. It's what keeps it fun as well. And he was also telling us that his year for applying was very competitive for TBI. He's like, and it's getting more competitive every year. So what advice would you guys have for residents that are interested in TBI? And then what kind of opportunities should they be seeking out while they are in residency?
Yeah, so this will be, Maria was kind of an easy find for me being, you know, full disclosure, first year fellowship director, and she's within our own program. So with it being kind of a launch and just knowing we had a great internal candidate, went ahead and had Maria be our first fellow. So we'll be getting into that recruiting process. I think anybody who does fellowship will tell you that it's a bit more of a, you know, personal relationship with the director, with the fellowship director and the fellow, just because it's usually just you and that person. So obviously work well together personality wise. But I think for me, I mean, obviously want someone who's shown some interest throughout the course of their residency. We here at Baylor are part of the model systems, the TBI model systems. So research is a big piece of what we do. Dr. Dubiel does a lot of that for us here in the fellowship. So I think having some direction, because there is the expectation that you will complete a research project while you're here. And then I also think too, just having, you know, some, and again, it's a little less concrete, but just that personality that is really going to be a good fit for dealing with families who are recovering with trauma, who are coming into the meeting you in our system full of, you know, kind of distrust, navigating those difficult situations. So good communication skills. And then I think just what everybody would tell you would be, you know, initiative, you know, detail oriented. Just at this stage of your training, you really should be at the junior attending level. So just evidence throughout the course of your training that you've always been a go-getter. You know, you're gonna really blaze your own trail here, and we just kind of sit back and advise, so to speak.
I think for me, you know, just going through the fellowship process and interviewing at other places, I mean, just know that, you know, these are all at really well-known academic institutions where attendings are there who they really take a pride in teaching. So wherever you go, I do think you will get a good education. But I think the biggest thing that I did to do was exactly what Dr. Phillips said. I made sure I showed an interest. So I did a little bit of brain injury research. I had any volunteer opportunity that was available. You know, a lot of the therapists know different local events going on. So I went to local events, did some volunteering. And then I think the most unique thing I did was at my third year of residency, I made my own elective where I rotated in different subspecialties that related to brain injury. So I spent a couple of days with a neurologist that specializes in seizures. I spent time with our neuropsychologist. even time with our therapists at our day neuro program, and also some time with the radiologist in the radiology department looking at neuroscans as well. I think, of course, PM&R is such a team-based field, and I think brain injury even more so is because our patients really can't always communicate their needs or their concerns. And so I think exploring that in your residency and really seeing what each specialty has to offer. So you I formed relationships with these people, but then I also got to see how to best utilize the team to help best treat your patients as well. So I think that was something, just kind of get out there and explore as well.
Yeah, that's great advice. So being proactive, Dr. Phillips was talking about looking for that in a candidate, and Maria, I think when you're a medical student, we knew that, that's kind of your personality. And so while your residency may not have like specific events, for TB, I think that's great that, you reach out to other people in the community who would know, what's going on. So like therapists, there's always, big cities and small cities will always have some sort of organization going on that you can always kind of volunteer at. So that's great advice. So you guys both ended up doing your fellowship in the same, with your residency program. So Dr. Phillips at UPMC, and then Dr. Pollifrone at Baylor, Dallas. So what are some of the pros and cons of, staying at the same institution where you did your residency? And then Maria, did you have any hesitancy of joining like a brand new fellowship program?
Sure. So yeah, staying at the same pace, like I said, interviewing other places, I felt like I would have gotten a great education absolutely anywhere. But I think with staying in the same place, I already knew Dr. Dubiel and Dr. Phillips, and I knew how they taught. I knew kind of how they ran their practice, dealt with the team, the therapists, the nurses, the patients, their families, and they all kind of matched my views and how I envisioned myself running a practice. So to me, it kind of made sense to stay there. And so I think those are the pros. Cons, I think, it's staying at a new place, at the same place, is that brain injury is so diverse, even within the same state, academic, not academic, inpatient, outpatient, what resources you have. People use different meds in different regions. So I think, that is a con, but at the same time, going into the brain injury field, that you're in a field where you're going to be a lifelong learner, because things are always changing. And then did I have any hesitancies? Honestly, not too much. I think me and Dr. Phillips have a really good relationship, very open communication, and kind of from day one, it was like, we check in at least once a week, and she basically just said, hey, you see any opportunities for growth or things you want to change, like let's work together and improve that. So I think knowing that I had the potential to influence that kind of took my ease at rest for that. So.
Oh, go ahead. Sorry.
No, go ahead. No, I was going to ask another question, but please answer.
Yeah, I mean, same kind of philosophy for me staying in Pittsburgh. Like the reason that I was drawn to brain injury was because of the people that I worked with. My fellowship director, I considered a really strong mentor. Again, like kind of echoing Maria, really enjoyed her style of interacting again with families, patients, and there's just so much to learn in that extra year from that just really is not in a book. And again, a big piece of that is negotiating difficult situations and conversations. And she just had an art about it. And yeah, same thing as well, whether this is a good or a bad thing to be determined, but there is quite a bit of variability, as she highlighted, in how we all practice as brain injury providers. So we all kind of, there's evidence obviously for certain things that we reach for, but we all kind of do it in our own way. And a lot of it is based on how we were trained. So, staying in the same place versus going somewhere else, you definitely would see kind of that difference. And again, if that's a good thing, a bad thing, that's obviously a personal decision. And a year goes so fast for fellowship that, it is kind of nice to not have to worry about, by staying locally or staying in your program, you don't have to move, you don't have to adjust to a whole new system, EMR, how the hospital works. And so you just kind of really got to, or at least I feel like I did, really just learn in that year.
Agreed.
No, that's awesome. And I was just going to brag on Baylor a little bit, because obviously we were proud of where we trained at, that you guys have a wonderful brain injury program. I know it's new, but I'm like, you guys had a really good program before it was even a fellowship.
Specialty program.
Yeah, exactly, specialty program. Because Baylor is associated with the big hospital, which is right across the street. BIR is a 100-bed standalone facility. The brain injury floor is a locked unit. They have very low-level brain injuries. And it's a level 1 trauma, which I think is important to be associated with, so you can see those degrees of brain injury. One question I was going to ask is, you had mentioned that Baylor was a model system. Can you explain a little bit more about that to our audience, what that is?
So it's actually quite a prestigious designation. So we do share the model systems with UT Southwestern, but we do get a fair amount of the patient cases. But basically, it's a research body that comes with funding that allows us to further the science and understanding of both the pathophysiology, but also the clinical implications of brain injury. And it comes, we get access to a large database. So in terms of sample sizes, when we're conducting our various experiments, we have a large area to pull from. And also we collaborate with I think there's, and this is where Jubil would be, I'm not, she's our researcher, but I believe there's only a handful throughout the whole country that we're able to also collaborate with, and just some of the brightest minds in the field. So really cutting edge, staying up to date. So again, just it's been an honor to be a part of that. And I believe we just got reaccredited for another 5 years last year, I think.
Yeah, because it was our 3rd year, I think, when they were going through
all
the
the paperwork, all the
it was a big deal. Yeah, I remember. Yeah, it was. No, that's awesome.
They were able. We have a great research team here, and able to, through the projects we're working on here at Baylor, get that cycle renewed for again another 5 years.
That's awesome. Congratulations on that. So what advice would you give to new attendings? We have some, I know she's probably watching, she was on yesterday, that she had just finished her brain injury fellowship, and she was just like, transitioning from being to a fellow to attending, which you will be there before you know it, Maria. You're gonna blink your eyes. What advice would you give to new attendings?
There's a huge learning curve in the first year. So I don't think I have opened my computer more than in that first year to check on my patients, probably hour to hour. So you really, and again, I had, and this is what I hope to accomplish for Maria too, I had a really great team up in Pittsburgh where they did let me essentially, be the primary on all my cases, but there's just still so, when that net is gone, you kind of, I'm sure you all can speak to that. It's just, you're very aware of that. So it's like, oh my gosh, I have nobody per se to run this by. Granted, Randy Jubil has been a great mentor for me. So that was another plus of joining the Baylor team, was to have a partner. But yeah, I would say really just be prepared to learn a lot. For me personally, when I first joined Baylor, I thought I was going to be doing inpatient primarily. That's what I knew. Pittsburgh was very heavy with inpatient. And so that was one thing. And then I've ended up actually doing a pretty fair amount of outpatient as my primary. And so just dealing and learning about the chronic issues as people have transitioned out of inpatient rehab, and just all the specialty programs in the state, and how to get people back to driving and back to working. I have learned so much, and as Maria can attest, still learning as we, how do we decide to let people carry guns again? All that fun stuff in the state of Texas.
Oh, Texas.
Yeah. So I've continued to have a huge learning curve. So I don't know if that's advice other than just, be prepared that you're gonna, I've probably learned just as much in these last years of practice that I did in all of residency. So, but yeah, it's been good. It's been unexpected, but I'm very grateful.
What about, can you talk a little bit about, what it was like setting up this new fellowship program?
Well, I will say from, pretty much early on when I joined faculty here, just looking at all the components in terms of, there's a very large university hospital right across the street. So opportunity for amazing consults, level 1 trauma, but in addition to, Salmon's cancer, so tumors, anoxia, just a fair amount of complicated strokes. So that was a great piece, a really strong, again, model systems, TBI inpatient unit, but then we also had a lot of specialties that worked with us between neurooptometry, neuropsychology. We have the day programs. Baylor has a transitional unit that we've opened up in the last year. So for those, it's a residential program for folks after they've post-acute from inpatient. And so just that continuum that we have here, it just made, to me, I just couldn't fathom why we didn't have a fellowship. And it really was very similar in pieces to what I was able to train with and feel like I got a great education. So anyways, long story short, a lot of paperwork, a lot of paperwork. But a lot of help from everybody. I also had to secure funding because Maria needs to be paid. But so I had to go before GME and some of our other, just kind of our funding sources here and get approval for that. So it was a lot of work, but definitely something I enjoyed. I really enjoy just program building. I'm one of those people that I probably can't just see patients and come home and see patients and come home. I like having other things to work on. And so it was, I don't know, what do you think, Marie, about a year that I was working on that? I'm trying to think, probably about that long. Finished it on maternity leave, so last summer, and got it through.
Multitasking, huh?
Yeah. So got it through with the ACGME approval this past fall. And
Awesome.
So yeah, it was really exciting.
So you guys are getting ready to, when is applications just open up for fellowship? Is it September?
I think it's,
I should know that.
I think it is. I think it is because I think it is. I know, but it's like COVID. It's like, who knows what is happening every day.
I think we're still trying to figure out, what interviews are going to look like, all
yeah.
that. So yes, it's, I'm sure it's coming up. It's kind of impossible to believe that Maria's just here starting, I have to be thinking about who the next one's going to be, but yes, likely this fall. And yeah, I'm really excited to meet people who are interested, for sure.
That is very exciting.
Do you have anyone that you talk to about, setting up the fellowship program, like some of the nuances? Is there like a group that you have that, you talk with other fellowship directors?
Not at the moment, no, because even mine at UPMC, she's moved on. And so no, not at the moment. We, again, I think everybody, I'm sure it's out there, but I think all of us right now are just kind of trying to figure out how to do life at the moment. So I'm on the women's physiatry group. We kind of, go through there and plug things through there. But otherwise, haven't quite gotten all that. I was planning to go to a fellowship director or program directors conference back in I think it was March. Anyways, when all this started, and then now everything's just kind of changed and shut down. So.
Okay, we got some questions.
Here. Yep. Okay, so Priyanka, so she's Dr. Shah. She's the one that graduated recently from fellowship, and she has a question about salary. So how do I know I'm being paid comparably to other new attendings? What do you expect in terms of increase in salary? And do you ask after you've been, become board certified in brain injury? So when do you kind of ask for a raise and some of that stuff?
I think it's going to kind of depend on what model you're looking for. That was the hard part, or what model you end up in. That was the part about finding a job with a brain injury fellowship. Do you want to do an academics path, or do you want to do more of a private practice? Obviously, there's more opportunity, I think, for compensation in a private practice. I did find in my kind of university-based jobs, this is what we pay, and this is what it is. So then you start to look at, for me, schedule and location, those three things they talk about: money, schedule, and again, location. But I will say, as I've kind of collected a few more feathers, or whatever you want to call them, there's opportunity for negotiations just for like the fellowship director stipend, medical directorships. But I know there's the the data out there that talks about what people make. But I've found that, again, in the academic settings, this is all over. I interviewed in multiple places kind of through the country, that they're not that willing to negotiate a whole lot. So for me, it was location and just kind of schedule. And I wanted to take care of people who are who are complicated, right? So, we get the disorders of consciousness, we get severely brain injured, we get just very complex cases. And for me, that was important. from how I practice. I don't know if that answers the question, but it's a touchy subject. But I always, I think, yes, I don't know that you need to wait for board certification. I do think that this brain injury is definitely becoming a more recognized subspecialty, that people are really realizing the importance that we have on these cases that, especially in the chronic setting, there's not a lot of good options, not a lot of good resources. A primary care doctor will just sign a prescription saying, yeah, you can work and drive, but they have no idea what this person's been through, and a quick bedside exam is not going to tell you that they're safe behind the wheel, right? So just things like that.
Right. Priyanka, I think you can also probably reach out to the Women's Physiatry group on Facebook if you haven't. This is probably a good question to also ask on there. And I think as brain injury is becoming more and more popular, you guys can probably even make your own Facebook group, I would think. But then I'm sure you would have people like Sheena and I are going to join it anyway, because we know what you guys are talking about.
I mean, and salary is a touchy subject, but I think especially as women, I think we need to be a little bit more transparent and, just more forward with, and even just talking to each other, letting each other know, hey, this is what my contract is. And I know Benecia and I, we do that, all the time with some of the other people in our group too. So, and so Priyanka's also asking, would love to know more about RVUs. I don't know how Baylor is, if you guys are on the RVU system now, but generally how to be paid fairly as a woman, and we are often paid less than men, and we often don't ask for more. So yeah, that's kind of along those terms of how we kind of have to support each other and, just be more transparent, I think. Not be afraid to talk about it.
Yeah, Sheena and I talk about money all the time. We do. Tevin also asked a question, and he's like, what is the best advice for pre-med students enter medical school? And I don't know if you're interested in brain injury specifically or just PM&R, but exposure, I think, is probably what we would all say. Try to get as much exposure. I know it's very difficult right now in the COVID time, but like I've sent a couple medical students Libby's information at BIR in the research department. So I think you can always try to get involved with the research. They do so many research projects at Baylor. And if there's anything, even if it's just data collection, they always need eyes and hands to do some typing. So just get exposure and get involved.
I know for me personally, when I'm interviewing medical students for residency, I'm very interested in how the applicant has learned about PM&R and how, if they have a good sense of what our role in medical care is. So just that is something I'm looking for whenever I'm interviewing, is again, what do we do? Because even my husband, who's emergency medicine, still doesn't quite know what I do. So
that is so fun. Dr. Omar Saline says, I see you, Maria. Very good. Any other questions from the audience? Hey, so Maria, can you tell us a little bit like how your schedule is set up as a fellow?
Yeah, so I'm only in like my, third week. But I'm on consults right now. So right now I'm just kind of going to consults, but I do have, every Wednesday we do continuity clinic where I go to Dr. Phillips' office, and right now they're mostly all telemedicine, which I think is important right now because that's maybe the new wave of the future. We're still doing some procedures, but those are my patients. She's kind of in the room. She'll chime in at the end if anything, but those are my patients, and then they're scheduled for my clinic throughout the whole rest of the year. So we're trying to get patients from that are discharging from BIR, so the inpatient rehab hospital, and then the goal is for me to follow them throughout. Also doing some Botox within that clinic as well. And then Dr. Phillips, you can correct me if I'm wrong, I think the rest of my year, there will be a total of 5 months inpatient, 2 or 3 months consults, doing some outpatient with her, and then various electives as well, but just kind of COVID is kind of depending on some of those at this time, but a lot of inpatient, and then I think it's a really good mix of both inpatient and outpatient, and there will be some research time in there as well. I think the outpatient, doing with Dr. Phillips, but then also some time with maybe some sports, do a little bit more concussion stuff, doing some time with hopefully some like neuropsychology, ENT, but once again, all of those kind of interrelated fields that we will deal with, radiology, whatnot.
I think that hopefully you'll get to come down to spend some time with Lan again. I know she enjoyed having you.
So Maria, I know it's a little bit early, but do you know, after fellowship, what your plans are? Are you going to plan on doing more like inpatient, outpatient, a good mix of both?
I'm not quite sure yet. Yeah. I want to get through boards in a couple of weeks, and then then I will really start. I think once I go through a couple more months of like just straight inpatient, I mean, you get 3 months over 3 years in doing more outpatient. I kind of want to get through a few more months to decide, but I really like both. Outpatient was a little intimidating at first, but then with COVID, I got to spend some extra months. And so I'm feeling more comfortable with that. So it's just wherever the opportunities are as well. I think with brain injury, you kind of have to know how to do both. Depending on where you get a job, you might have to end up doing both as well. So just trying to prepare for both.
Yeah, I joked because she spent so many months with me towards the end of her 4th year. I'm like, are you sure you still want to do fellowship? Have I like driven you out of it? Because yeah, we ended up doing some out. And I will say, like, again, the hardest part of outpatient is resource navigation and just trying to figure out, I mean, granted, there's the medical things, there's the headaches, there's the sleep issues, that come up, but a lot of mood behavioral things really start to pop up. But then also too, people lose their jobs and then they lose their insurance, and how do you navigate what the world has to offer when life is turned upside down? And that's really the part for me, again, as I stepped out into the outpatient world, that I just had no idea about. And it's going to be very region specific. So even if you end up practicing in a different state, that what's in Texas is not an option necessarily in Pennsylvania. Was what I've learned as well. So I tried to build in a fair amount of that outpatient time into this fellowship as opposed to just a continuity clinic, because it's taken me, I'm practicing now going on 5 years, and I still am figuring things out in the outpatient world on that front.
Yeah, I think you really touched on a good point, is what kind of resources are available, just like you said, regional. I know my partner, Lan Lee, is really good at that. You walk into her room. When we had our building built, she's like, I need my door to be this big because my patients' chairs need to be able to fit into it. And you walk in the room and she has like all these resources laid out. She's very good at just knowing what, I'm like, Lan, where do I go here? She's like, here's this pamphlet, this one, this one. So if you haven't met her, I will definitely have to introduce you to her. She's really big. Yeah. Sure.
Dr. Slott has a clinical question. When do you go from oral baclofen? When do you go from oral baclofen to a baclofen pump?
So I don't, at this stage in time, I don't have baclofen pump management. I trained on them as a resident and a fellow, but I think at this point, at least in our system, we don't have a lot of great support when there's issues. As we know, baclofen pumps are amazing, but if they do have problems. But I typically am referring out, for pumps, if I just feel like, meds are, in my experience, they're fine to a point, but they just really, there's, especially in the brain injury world, they're very sedating, and that's something we're already fighting. I do a ton of Botox if able, but then when we're really getting to the point where the Botox is just, 600 units is just not enough in a lot of cases. So I've got a few that I've referred out for trials and whatnot. So, but then they end up going, to people who do fill them. So.
Yeah, no, that's understandable. Dr. Lee does a lot of them. And she goes out of town, she's like, Benecia, if something happens, you're my backup. I'm like, don't leave me.
Yeah, baclofen withdrawal. That's one of the emergencies.
She usually gets called like around, usually 2 or 3 times a year to various ERs in Fort Worth, because she's like the only one that's managing them in Tarrant County. So they call her. Yeah. So usually the rep will give them her number, and they have to give her emergency privileges to come and see a person in the ER.
Wow.
Yeah, it is quite the commitment. So
it is.
Yeah. but they are great.
Great questions. Any other questions, guys?
Omar says, PM&R Fort Worth needs you, Maria. Well, you guys, we thank you so much for taking the time out on your Sunday and joining us. This was great.
Thanks so much for having us.
One more has popped up. So how many rotations in PM&R, oh my gosh, I can't speak today. How many rotations in PM&R residency are dedicated for TBI? Like how many months are required in residency?
4 months?
I did inpatient, I think it was 3 months. I don't exactly know what's required. I'm assuming that must be what's required, but our program in particular, your PGY3 year, when you're doing 2 months, your last 2 weeks are with Dr. Phillips. And then we also have one of our outpatient rotations is called neuro outpatient. So you do some time an outpatient as well within Dr. Phillips' clinic.
That's awesome.
So you get a couple more weeks and months in there as well.
Sheena, how many did we do? 4 or 3 months?
I'm trying to remember.
I know we did 2 months for sure as a PGY.
2, yeah, exactly.
3,
PGY
and
2.
I think 2, and I think we did 1 month as a PGY 3.
Yeah, I think it's 1. I think it's 1 month with PGY2, 2 months PGY3 is what it seems.
No, they switched. Okay, yeah. No, awesome. That's
Right. Our final question, guys. We ask all our guests. We almost forgot.
Almost forgot. Yes.
If you weren't a PM&R physician, what would you be? And you can, talk about in medicine, what kind of field you would go to, and then also if you weren't doing medicine.
I don't know that some days I wish I'd picked radiology because then I could do it, from the beach, but that's on my really rough days. And I think I would not be happy with that overall. I know that to be true. Otherwise, if it was outside of medicine, I just really do like problem solving and operations. So, something I'm sure business related, I don't know. But again, that's again also doesn't feel like I'm advancing anybody's quality of life. So
yeah, within medicine, I think the other thing I liked mostly was like neurology, just because it also was neuro as well. I also liked sports medicine too. Those were always probably my 2 other interests besides PM&R. Glad I ended up in PM&R, but outside of medicine, I don't really know. I was thinking about this today, and before I went to med school, I was deciding between a med school and if I don't get in, I can always apply to grad school for math. So if I would have done that, I don't know, some sports analytics or something, but honestly, I have no idea. In a perfect world, I would get paid for eating at new restaurants.
Yeah. Dr. Phillips, yeah, she was running to go get her charger, and then
we did have a last minute question that just popped up. Derek asked, should first and second medical students find research that they can be involved with in a remote setting during COVID? I think if you can, I think it's a good idea.
Was it about getting involved in research during the COVID time?
If you can do something remotely.
Oh, I'm sure. A lot of it's chart review for the retrospective studies and whatnot. Absolutely.
Yeah.
Definitely just reach out to programs and just ask, how can I help? Just again, the word of the talk is be proactive. So
especially at the so the model systems, you have it for TBI and SCI. So you could probably just Google what programs in the country have those, and then they're going to be big research institutions, usually having several research projects going on, and see if there's something you can do remotely. I think that'll be good. Awesome.
Oh, yay. She's coming back. Yay. The battery died.
It did. I came into BIR and then I used this computer because anyways, but yeah, so I just found the battery. Okay, I apologize. That was awful.
You're good. I'm glad you were able to come back on, but just thank you again for joining us today. This was a good talk. Lots of pearls.
Yeah, I'm excited for you guys in your program.
Yep.
Any interested applicants, if you guys reach out, happy to talk more about, the curriculum. I think that's the good thing about this, again, new venture is it's really, there are things we have to accomplish, obviously from ACGME, but it really is a lot of personalization, opportunity for personalization. And like I said, we've got some really great elective folks who are willing. So, ENT with swallow and voice disorders, vestibular specialists. We have neurooptometry, neuropsychology, really trying to work on getting folks into our community programs, spending time with them. We have the day program. I'm medical director of the transitional facility. So really a complement, I think, of really what brain injury has to offer. So
how can they get a hold of you if they are interested or have any questions for both of you guys?
Yeah, I think I'm trying to think the best way to, probably my email would be okay. So I don't know if you guys put that up, but yeah, that would be a great way to open that dialogue. So happy to talk with anybody who's interested. Like I said, Dr. Dubiel is also, she's our medical director of the inpatient side of things here. She's a big piece of being involved. She's been doing this for 15 years. So I think together we've got a really great inpatient, outpatient complement.
Oh yeah, you guys are both great. When I ever have a patient from Fort Worth, I always come like, Dr. DeBill, I need you to take care of my patient. She's like, okay, I'll do it. It's great.
And I'd be happy to answer whatever questions, general, whatever, whatnot as well. But thanks again, you guys. Always great seeing y'all.
Always great to see you.
Good to see you guys.
Yay.
You guys can always follow us, on our Facebook, Instagram. This video will also be posted on YouTube, so I'll send you guys the link as well, and on our podcast, Spotify and iTunes. So
I know, we're so cool, huh?
It's everywhere. All social media platforms.
This week, you guys who are listening, we kick off our residency takeovers. So different residencies will take over our Instagram page. This Tuesday, we have our alma
mater.
Thank you, that word. I couldn't get the word
now
out.
I can speak.
We can't talk. Shenisha. Baylor, Baylor's going to take over on Tuesday. Then we have the University of Minnesota on Wednesday, and then UT San Antonio on Friday. We look forward to seeing their programs and meeting their residents. So be sure to look out for that, guys. And